Effective natural herb, kratom banned by the DEA. The use of prescription opioid prescription pain medication has greatly increased over the last 2 decades. Data from the Centers for Disease Control and Prevention show that opioids drugs were involved in 28,648 deaths in 2014. The overdose deaths on opioid medication has quadrupled from 1999 to 2014. Mitragyna speciosa, also known as kratom, is a plant native to Southeast Asia. Kratom has great potential to mitigate the effects of opioid addiction and in the treatment of chronic pain, which is typically treated with opioid drugs like
oxycodone.
Kratom is a relative of the coffee plant that promotes feelings of calm along with heightened senses and a higher tolerance to pain. DEA officials classified 2 chemical components in kratom, mitragynine and 7-hydroxymitragynine, as Schedule 1 narcotic. The agency will disregard any input from concerned parties or independent scientists prior to the ban. When turning down the petitions for rescheduling cannabis, the DEA used much of the same arguments in the case of scheduling kratom. The DEA is not aware of any currently accepted medical uses for these substances in the United States. A study from University of Massachusetts Medical School recognizes kratom as a treatment for opioid withdrawal. It claims that kratom could be used to help withdrawals from other drugs as well. Typically, when temporarily banning a drug, according to the administrative procedure, the DEA allows interested parties to present their own findings and ask questions. When it comes to kratom though, the DEA stated in its own notice of intent that officials believe there is good cause to forego the notice and comment requirements of Section 553. A counter-petition asking the White House to not classify kratom as a Schedule 1 drug passed the 100,000 signature mark, triggering a response from the Obama administration. White House petition response policy states that if a petition gets over 100,000 signatures within 30 days, the White House will respond within 60 days. The DEA has denied 2 petitions to reschedule marijuana under the Controlled Substances Act. Evidence that cannabis is medicinally useful is stated in multiple scientific studies. Federal legislators and the DEA continue to fight against rescheduling cannabis to a schedule that would allow it to be used as medicine. Contrary to the recent DEA press release, the Department of Health and Human Services owns a 17-year-old patent on cannabis. Titled, "Cannabinoids as Antioxidants and Neuroprotectants." Its abstract reads, "Cannabinoids have been found to have antioxidant properties. This newfound property makes cannabinoids useful in the treatment and prophylaxis of wide variety of oxidation-associated diseases." The evidence that cannabis is medicinally useful in treating chronic pain is undeniable. Kratom could be found similarly useful, helping patients and addicts alike. 1 in 4 patients prescribed opioid medication struggles with addiction. Thousands of patients are dying every year from opioid overdoses because they are in pain and do not have a safer alternative than prescription opioids to relieve their pain. Every day, over 1,000 people are treated in emergency departments for misusing prescription opioids, with 46 patients dying each day. Researchers from the Johns Hopkins Bloomberg School of Public Health conducted a study. In medical marijuana states, the annual number of deaths from prescription drug overdose is 25% lower than in states where medical marijuana remains illegal. It is apparent the scheduling of kratom and cannabis amounts to government protection of an industry that spends millions each year to lobby politicians in Washington. DEA and FDA are clearly suppressing the objective evaluation of science. Big Pharma and regulatory agencies continue to restrict the scientific pursuit of truth in the matter. Kratom and cannabis have shown a very low risk profile in terms of health or societal danger. September 30, 2016 kratom will join cannabis on the Schedule 1 substance list.
An overdose is a health matter, it's not a police matter.
Somehow the pharmaceutical industry can manufacture a synthetic version of the same active ingredient and it magically becomes legal. The federal government should leave medicinal evaluation of drugs to medical professionals and scientists, not to drug manufacturers and their lobbyists.
I got you.
The DEA just wants the world to know. If you try to use a natural plant instead of costly, highly addictive, mind-altering, potentially deadly pills, we will break down your door, take you away from your family and throw you in prison.